Did you know that globally, nearly 90% of patient-facing healthcare workers are women? Yet, they earn nearly 40% less than men, with the largest wage gaps in low-resource settings. This is important because with AI adoption in healthcare, these inequities risk deepening. Women are underrepresented in AI decision-making spaces, and secondly, they face slower adoption of technology compared to men, leaving many excluded from innovation opportunities. These quotes from women healthcare practitioners in Kenya during a training session on AI illustrate fear and a utility tension. The concern isn't AI is bad, it's AI feels opaque. We don't understand how it works. And these are sentiments shared by many women in similar contexts. Hi, I am Njoroge, a healthcare professional with experience in digital health and recently relocated to North America. This is my leadership project on building an AI in healthcare curriculum for mid-career women in Kenya. I set out with two key objectives, which were iterative and mutually reinforcing. Skills building revealed knowledge gaps, which in turn informed the instructional approach. Participants were recruited from an existing women in training cohort. Of note, they self-selected and were intrinsically motivated to learn. There were 15 women who signed up. Participant profile reflects a mid-career concentration, with majority being specialists, but with functionally diverse roles. Participants reported moderate AI familiarity, but use was shallow and largely limited to chatbots and a few tools. This indicates that the gap is not necessarily awareness, it's confidence in application. Many had encountered AI tools, but lacked a mental model for how and when to use them effectively. The virtual sessions lasted 1.5 hours in the evening. In the first session, we unpacked common AI myths and reframed its value to shift participants from apprehension to appreciation. The second session explored AI use cases they'd identified and how AI literacy could empower them as advocates for ethical and equitable AI deployment. This was important as this group had decision-making influence. The third session was a hands-on exploration on AI prompting for professional and personal use. Tying my key lessons back to the objectives, 3 insights emerged for the knowledge and skills gap. First, there were misconceptions where AI was perceived as one thing or tool and the need for total comprehension before one could use it. Next was fear and an identity tension. These women expressed anxiety about their current skills becoming irrelevant. They also described the tension between AI and the relational nature of their work. Having a full conversation with a computer interface felt daunting. One likened it to speed dating. Finally, there was limited understanding of digital health information systems in general, the data backbone of AI, which further amplified their hesitation in using AI tools. Regarding instructional approach, for the knowledge to be relevant in building both skills and confidence, participants need to see where they fit. Their motivations varied, from clinical efficiency, personal growth, and even intergenerational relevance. Some women felt empowered to engage more confidently with their tech-savvy children around AI. So what's next for this project? A couple of the women have come up with short-term AI learning goals, and I'm working with them to refine these and hold them accountable. It would be great to see these groups' work and voices amplified on a bigger platform like the Global Digital Health Conference. And given the positive feedback from the participants, we're exploring a packaging that would put this as a module within the formal fellowships curriculum, opening it up to men as well. This project has been a meaningful and insightful part of my leadership journey. I've learned to normalize vulnerability and having to lean on others to get the job done. I've also learned to recognize and acknowledge the process as much as the outputs. And I thank my mentorship group and my peers from Nairobi for being part of this journey. Thank you for your attention.